Hey guys, Tony Maritato here, licensed physical therapist, and in today's video, I want to share a story. It's related to an email I received from somebody who I had worked with a little bit in the past. Now, I asked for permission to share this story. I'm not going to share any personal details, but I think this is going to be helpful both for patients who are running out of physical therapy coverage under the Medicare benefit policy manual, but also for therapists to better understand what kind of coverage is provided, what is going to be covered through Medicare in an outpatient setting. So for a little bit of context, this individual is an adult, 30-year-old. They have cerebral palsy. They had been utilizing physical therapy services, and he was saying that he's going to a neuro outpatient setting. The physical therapy was being received twice a week. Each session helps immensely. They're calling there, as in the physical therapy team, calling it maintenance physical therapy. So there's rehabilitative physical therapy and maintenance physical therapy. Within the scope of maintenance physical therapy, specifically to Medicare coverage, there's covered and non-covered maintenance physical therapy. So this individual is saying last week the physical therapist needed to do a 10-visit progress report and was saying that since the patient is plateauing, they want to wrap up therapy in April. Right now it's February. They were saying the personal care attendant or assistant can deliver the services that are needed, but this individual's personal care assistant doesn't want to deliver the services that are needed. He was saying that it's hard or uncomfortable for the personal care assistant to deliver the services. The services are basically stretching. The patient was saying that he's made so much progress, he can't afford to lose it. As much as he can pull a resistance band, lift a dumbbell, do other exercises independently, what he can't do is stretch himself, and he still needs the guidance. So he was saying that he emailed the physical therapist asking about his concerns, that he wants to continue therapy, asked if he could reduce it to 1 time a week. As far as maintenance physical therapy, does this cover a continuation at once a week? What should he do? He knows the CP, the cerebral palsy, isn't going away. He's just going to get tight again if he stops doing therapy. He doesn't have anybody around who can help him, including his personal care attendant. So what are the suggestions? I think that's a great question, and we kind of see this quite a bit in outpatient, particularly outpatient neuro rehab. I come from outpatient orthopedic, but still, I have patients that are presenting with neurologic involvement. We know that it's a progressive condition. We know that it's not going to reverse course. We also know under Medicare guidelines that while maintenance therapy is a covered benefit, you can reference the GIMO settlement. It was a situation in which continuation of therapy was covered for an individual to slow or stop the decline. So just because the individual is plateauing or because the individual isn't improving doesn't mean that continuation of services isn't justified. But on the flip side, the physical therapist and the facility needs to also be aware that at some point, if they're not able to continue to deliver the services that require the skills of a therapist, Medicare absolutely could come back, absolutely could review the case, review the documentation, make a determination to say that these services are no longer medically necessary. They're no longer covered under the Medicare maintenance policy, and Medicare would demand a refund of payment. And in a situation like that, the patient is not responsible for payment. Medicare would take back the money that was paid to the therapist, and the therapist at the end would have delivered the service and lost the money in doing so. So there was lots of things going on here. There is no clear definition of what exactly maintenance therapy is. The Medicare benefit policy manual has a couple examples in which it shows what may be covered under maintenance, but even in the example, it doesn't guarantee coverage. So I can tell you what you're trying to do as the patient is you're obviously trying to receive the maximum benefit allowed for the policy that you've purchased because you're paying for this insurance coverage. But on the flip side, as the therapist, you're trying to protect yourself and the liability of the clinic because if you deliver services that are not covered or deemed not medically necessary in the future, you're going to lose all of the money that was paid to the therapist, lose all the money that was paid by Medicare, and ultimately you can't operate a business that way. So I would tell you that while there is no cut and dry answer, there is no single solution, there are a couple things that you can self-educate on. I'll send you some resources and I'll link them down below, specifically the CMS Medicare Benefit Policy Manual, in which it talks about maintenance therapy, what is covered, what is not covered. And then depending on your state, you, the patient, I would encourage you, I'll find some links. You can go to the state Medicare MAC and see what kind of coverage determinations are there. Because in some cases, they'll explain in more detail what the federal guidelines are. But I can tell you that there are examples in various Medicare policies where Medicare clearly states once it's determined that the patient does not have the physical capability of continuing to perform the required intervention and the patient doesn't have the support system around them to deliver the intervention, that the intervention is no longer considered a covered service. So while I can't make the determination that once a week is in compliance with maintenance, it could be once a week, it could be once a month, it could be once every 3 months. The best that I could do is provide you and your therapist the resources, and together you guys can make the decision. So I hope that was helpful. If you have questions like this, go ahead and post them in the comments below and I'll catch you on the next video.